I'm the CEO and co-founder of Wesper, and we are changing sleep health for good, and some double meaning. And can you go to the next slide? And we are here basically to solve this problem. Clinical grade sleep testing is currently very discrete in time. You do it like one time typically for diagnostic, but you can't really measure it over time. It's not very comfortable, not very easy to use. And we want to change it. And the way we are doing it is by creating basically a sleep lab in your home. And we are able to measure multiple parameters during sleep, from anything from snoring, breathing quality, directly respiratory effort, sleep. Sorry, I'm muted. Can you hear me?
Yep.
Okay.
I can hear you.
Sleep stages, sleeping position, heart rate, etc. We also now working on integration for desaturation, blood pressure, and other parameters to really provide a complete solution for patients and users' health. We just recently got FDA clearance for our home sleep testing solution, basically using these two patches with a pulse oximeter to get a full diagnosis for sleep apnea. Really excited about this. We're going to launch it in the next few months, but that's kind of, this actually showed the level of rigor and clinical validation that we put into the product. So a little bit about the patch, if you can go to the next slide. So the platform, I would say, we see it as basically the future of sleep health. When we, this is part of this today's conversation. And the way we see it, in order to really take this field forward, we need to have these three major components. One is medical grade, having the ability to detect detect the relevant parameters and provide them for physicians and provider for diagnosis. The ongoing sleep management is a key factor in actually improving people's sleep. As I mentioned, like today, the paradigm in sleep medicine and sleep health is basically have a diagnosis and send people with treatment. But there is there are a lot of struggles in the sleep improvement journey, and I think the ability to measure this, measure objectively over time, clinical data is super important. The last piece is the specialist access, which is basically support. Those people, the sleep improvement journey is very, very lonely. We heard it a lot from our customer, and access to true expert is really a key to help people improve their sleep. So this is how we see the uniqueness of the system, and as building towards like the future of sleep health. Next slide, please. Quickly about the patches, very soft and flexible, very easy to use. We started at Cornell Tech University. We validated it in several clinical studies. The most recent one showed correlation of more than 95% with sleep lab. And as I mentioned recently, it was FDA cleared. Next slide. And what we are measuring is basically a lot of granular information, millions of points during the night, and we're able to do it night after night. And I think, as I mentioned earlier, this is key in understanding the clinical performance of any intervention, but also the improvement of user sleep in a very objective way. Those signals, as you see here, is very similar to what a sleep study would show. We are providing automatic analysis, but also it's readable by a sleep specialist. So the platform allows people to really understand and annotate the signals. And again, this part of the system is critical because now you have an interface for users, but also a very comprehensive interface for sleep specialists to be able to diagnose and read the data. Next slide, please. The users, on the other hand, immediately in the morning can get a very comprehensive report that includes all of the signals, data on their night completely. Again, we are looking at signals that are of clinical importance and were validated. And this is why we can show the users things that they cannot see in any other sleep device that is available to consumers, and this is important for their progress. We found that having this very easy, very simple way to present the information to users is very engaging, and people tend to keep doing those tests more and more as they see the data, as they see feedback on their intervention or generally about their sleep progress. Next. Once you measure the device night after night, basically you're able to start seeing your trends and see what really affects your sleep. We are collecting multiple subjective inputs, but also objective information, so you can really detect what is it that affecting your sleep and decode your sleep and understand it better. You also the experience also can improve adherence and outcomes for users. This is something that we put a lot of emphasis in. Next slide. Last piece is the access to sleep specialist. We provide one-on-one virtual consultation and in-app messaging, so people can really talk with a specialist, with someone that really understands what they're going through and how they can get better. And this is really helping people in their journey. Next. So essentially, we are now, I think we want to talk about the future. So I think one maybe thing to acknowledge that the way people are treating sleep today is very similar to what nutrition, diet, and exercise was about 20 years ago. People just starting to measure, just starting to understand the importance of ongoing management of these lifestyle factors, and we believe that we can be a key in this ecosystem, working with the user all the way from the diagnosis through consultation, providing prescription, but also improving engagement and adherence. And this is a cycle. It's not like sleep is not a quick fix, exactly like diet and exercise. You need to work or maintain good sleep health over a long period of time. And this is where the clinical grade measurements and the ongoing nature of the device is super important. Next slide. So if we're looking at the future, both of how generally sleep health will look like in the next 5 to 10 years, I think one is evidence-based telehealth. So now most of the telehealth consultations are being with just with video, audio, with very limited information that can be provided to physicians and providers. Now we're moving to an era when we can get more and more evidence and measurements from home with wearables, with other devices that can really help physicians to take care of their patients. The other piece is have even much more personalized data and insights on people's sleep, and we can get anywhere from lifestyle micro step to really improve your health and wellness, all the way to medical interventions. Predictive, meaning with all the data that we collect, we will be able to predict the likelihood for treatment success to different population, different types of disease. And this is a key mission also for us. And last but not least, value-driven or value-based care, as people used to know this or call it, really control patient journey beginning to end. Sleep is a very good example to this, where the sleep improvement journey in sleep therapy is very fragmented, very difficult to communicate between the different stakeholders, the PCP, the primary care physician, the sleep physician, the dentist, etc. So it's really, really hard to communicate and even understand the process. And having the ability to control the patient journey beginning to end is a key to provide value-driven outcomes.
So my name is Ed Pienkos. I'm the head of coaching for Aura Health. People know us as the Aura Ring. I'm going to take a slightly different approach than Amir and talk more generally to how wearables can help us with the advancement of health care as we move to the future, not only in the consumer space, but in the clinical and the academic space. So with that, if you'd go to the next slide. So Niels Bohr, I think, said it very well, and that is prediction is very difficult, especially when you're talking about the future. However, if you go to the next slide, I am going to make 3 predictions. And those predictions are healthcare will become more of a daily practice. I think we're already seeing this with wearable technology. Healthcare will definitely become more data-driven, and healthcare will become more personalized. And if anyone on the call has not experienced that, I think that perhaps your eyes have not been fully opened, not only to wearables, but the direction of healthcare in general. I think not only is this being driven by consumers and technology, but I also think it's being driven by need. So as we continue to move forward with the connection between wearables, technology, clinical, what's learned in the medical schools, as well as what's taking place in the clinical environments, I think that we're all going to see this increased integration between wearable technology and the healthcare practice itself. Go to the next slide. And to the next. So at the present moment, I think many of you would agree that lifestyle behaviors are our key drivers of disease. When we take a look at the slide on the left, we see that in 2017, the top 4 or 5 disease states were cardiovascular in nature, which are all lifestyle driven. Now, of course, we have diseases that are metabolic. We have diseases that are hereditary, but in most cases in the United States and around the world, we are seeing that it is the behaviors, the lifestyles, the habits that individuals engage in that are leading to the disease states that they are acquiring. So if we have the opportunity with wearable technology to increase the awareness, one of the taglines with Aura is how you feel, or excuse me, why you feel, how you feel. What are your behaviors? What are your interactions? What are the stressors and the other pillars of health that you're dealing with? And how can you modify them? If we can address these things with the use of wearable technology, not only is it a good step forward, but I also feel that you will see this in more engagement with conversation. And you'll see this in a few slides when I speak to that. In addition to the slide, oops, if you'd go back one more, go back to that slide. Proportionally, take a look at premature death. Yes, there is genetic predisposition, but still the primary driver is behavioral patterns. So it is still in the data, and it's still the progression. I think we'll still see this. Medical technology has reduced genetic predisposition and decreased it from a much higher percentage than 30 over time. And lifestyle, unfortunately, has increased in percentage. And again, this is just our society as we go forward. Now, Myung, you can go to the next slide. So I think many of you have experienced this or do continue to experience this, and that is our current healthcare system, no fault. I'm not making any negative claims here, any negative statements, but healthcare is very episodic. Oh, I'm not feeling well. I have a symptom. Something doesn't feel right. I go to the doctor and the doctor evaluates me. They take a snapshot in that short visit they have with you. They ask you some questions. They look back in your medical record as to your history, and then they make a diagnostic evaluation, or then they prescribe a treatment or a medication, but not so much a lifestyle intervention, not so much an education. And that's not the fault of the medical system. That's just the way it's set up. We all know you go in and the physician and their techs all have very specific engagement tasks that they must achieve during your visit. And there's not room for the education, for the conversation to take place. So very, very episodic. But when we have technology like wearables, and you see this in all of the graphic lines below the waveform, these are all of the things that are happening on a day-to-day basis that wearables are picking up on. That if the physician could interact with that data, in addition to the episodic meetings that they're having with the patient, wouldn't that be a much greater way to be more diagnostic, more evaluative, and provide more functional and innovative individualized treatment? I believe so. And so what's happening as we continue forward with these population norms, okay, we know that there's greater obesity. We know that COVID is a problem. We know that respiratory issues are a problem. Therefore, what are we doing? We are, in the medical environment, we are preparing ourselves and educating ourselves on that episodic trend at the time. But when you look back to COVID as an example, being that's so fresh, what are we finding now? That individuals with comorbidities that often are functional of lifestyle behaviors are the ones who are the most severely affected, where those who are more engaged in a more healthful, holistic environmental lifestyle, these individuals may be getting symptoms, may be getting the disease or the virus, and then they are moving on. They're passing through it. So if we can make the shift by collecting data on a more regular basis with the use of wearables, we now shift from a reactive model to a proactive model. And these are the things that I think that what you're seeing with the Mirrors tools and what we have at Aura and with Whoop and with Fitbit and with Apple Watches and all of this technology that's out there, we have this opportunity to engage at a much more individual level and a much more daily level with individuals as we go forward. Next slide, please. So how can we take this utilization of wearables and progress to this point, this more individualized, this more proactive approach to healthcare? Next slide, please. Well, one of the things is, I think, what you've been hearing. Technology will help us understand the relationship between the daily lifestyle behaviors and the health of the individual. We know that there are those 4 pillars of health: your sleep, which is the most foundational, your activity, your stress, and your general lifestyle in nutrition. So if we are engaged in those things with the individual in conversation, and even this can take place in the dental practice. In the dental practice, when you take a look at an individual, we know that the mouth is a gateway to your health. When you have poor dental hygiene, you're leading to other metabolic issues that can come about. So if we're discussing these things with the individual, not just your brushing habits, but your oral hygiene practice, what are other things that you're doing that engage the individual in lifestyle adjustments that not only meet them where they are, but help you improve their health and lifestyle, their overall well-being? This is a huge step. And with the use of technology and data, most importantly, the data that's collected, we can move into this daily practice approach. And then the consumer becomes much more educated. And going back to the old adage, an educated consumer is your best customer. So when you keep that in mind, if they're involved in the conversation, of course, we all have the individuals that will come in and they'll spend 25 minutes during a 30-minute visit asking you questions and not allowing you to actually get to the assessment. But what if we changed the system and allowed for that to take place by engaging in the wearable technology, so we knew that information before they came in and we could ask them specific questions related to their visit? This is what wearables can provide for us going forward. Next slide, please. I also believe, as I said in the early slides, that data will become more data-driven. If there's anyone on this webinar tonight that doesn't believe that, please call me. Please, let's have a conversation. But there's so many things that affect our health: the environment, your phenotypes, your genotypes, your socioeconomic status, your heredity, your daily lifestyle. All of these things have the opportunity to be collected in big data and then distributed through various formats, through conversations and clinical decision-making, through individual lifestyle choice and decisions that you make. And what is at the center of each of these things? It's profiling and data collection. And in doing this, what are we using to do that? As Amir said, in the data that he collects with the Whisper patches, with the things that are collected with wearables like the Aura Ring, we have this opportunity for an individual to literally have this information at their fingertips. And if we can help them make the connection between the data and their behaviors, we can then move those behaviors into an actionable way to help them with modification for improved overall well-being. Next slide, please. Healthcare will become more personalized. Let's take a look at our own life history, right? I'm in my late 50s, almost 60 years old. And in that period of time, I've seen a huge change in healthcare from a one-size-all drug-related formulation to things now which are more targeted medics. I mean, you can watch any commercial that's out there right now related to medication, and it no longer is saying, if you have diabetes, it's saying, if you have diabetes and you fit into this category, here is a drug that may work for you. And it's the same thing with sleep, and it's the same thing with dental and sleep, and it's the same thing with general health. These are things where we're now being more targeted, more focused. And as we move into the future with the addition of wearables and the data that they can collect, we now have this opportunity, as I was saying, to continue to individualize these treatments, individualize the action plans that we're providing to individuals. And not only that, but to monitor them. What is the compliance measured by a wearable? What is the change based on that action plan, that treatment? And then instead of waiting until the next episodic visit, you can be proactive in reaching out and saying, we noticed that, and you might want to make this change, or we might want to together collaborate on this next step. Wearables give us this opportunity. So excited. Next slide. So from a takeaway perspective, taking a look at wearables that are advanced level like Aura, what we can do is we can enable the measurement of these physiological factors in daily life. When an individual comes in, let's take a look at white coat syndrome. That's maybe or maybe not true. Individual comes in, their blood pressure seems to be good during the day. When they take it, when they get to the physician's office, it's higher. But if you knew it was just because of the visit in the environment, you could take action to this. Wearables help us with that. Research at the population level. I'll give you an example directly from Aura. We were able to do a study recently on 1,300 pregnant females in relation to the Aura ring and their fertility. 1,300 people at a cost that was lower than traditional research projects using 5. Why was that? Because we were able to use the technology. We didn't have to have a lot of people monitoring them in a closed environment. They were living their daily life. We were collecting the data in streaming. We were able to take that data and create the research project and obtain the data from that. And did all because of the wearable. So if it's with sleep, if it's with dental hygiene, if it's with general practice, we have this opportunity, and we can now scale these research projects at a much lower cost with a much higher percentage of the population. All of you have read research studies that say, we had 46 people in our research project. That's not a particularly great representation of the population. But if you have 13, 2,500, 10,000 people, now you have a much better representation. Wearables can help us do this. And finally, what it allows us to do is open up the avenues for this data to be utilized in the academic world, in the research world, in the practical application world, because it allows us that information, and information drives science. Data drives science. And if we have it in an easily understandable and obtainable way, wearables is going to be the way that takes us there. And with that, I'm going to say thank you for the time. And if you have questions, I'll look forward to those at the end of our session tonight.
Thanks so much, Ed. That was fantastic. And I think we'll start off. I want to say that this is going to be a fairly free-flowing conversation. At least that's what we want. So if you have questions for Amir or the vice versa, or Barry, anybody, feel free to jump in. We have a few obviously prepared questions, but I really want this to be more of a conversation than anything else. And I'll tell you that, as you were speaking, and as a sleep physician, probably at the front end of a lot of patients that come in with these data points, I think that the conversation between physicians and patients is going to change. In fact, it has changed, but it's going to change dramatically. I mean, patients, we're used to patients coming in and saying, hey, doc, here are my symptoms. Tell me what's wrong with me. But now they're going to come in armed with all of this data and say, like, I know what's wrong with me. Tell me what do you think, right? And I think that that's going to be a very interesting change in the paradigm of how, and I think as physicians and patients and all of us will need to be in a different world, not even to speak of how healthcare is delivered and reimbursement and all of that. But, one of the things that strikes me is that many companies and institutions now are taking sleep health pretty seriously. And one of the powerful positives of these consumer sleep devices is just the increased awareness of the importance of sleep health in particular. And Ed, I'll sort of direct this to you initially, but of course, Amir, please feel free to comment as well. But can you give us some examples like that you've seen in Aura? How the data that you're generating for patients has changed the way that companies and institutions actually work with their employees?
Yeah, there's two examples I'd like to share. One is with just a traditional legal slash consulting business. And they engaged with Aura as a company. And one of the things that they were seeking was, how can we help with the presenteeism that takes place with individuals when they come into work? And if people aren't familiar with that term of presenteeism, it's being at work physically, but not being at work in mind, in functionality, right? You're there, but your mind's somewhere else. And they were seeing a lot of this. And so one of the things we spoke to them about was, we know with sleep, disordered sleep, when you're not rested when you wake in the morning, your focus is off. Your attention to task and detail is off. Your safety in engaging in more high-risk behaviors can be at greater risk. So one of the things we focused on with them was, how can we look at your aggregate data, and then how can we make general recommendations to you as an organization, and then specific with individuals within the organization as to behaviors that may be happening with individuals. And one of the things that we found, which is very common in our world today, was overstimulation. A number of individuals were having trouble with their sleep latency and with their sleep architecture early in the night. And one of the reasons we found out very quickly was, these individuals were staying up late, working on projects with blue screen, with a lot of cognitive engagement, and then trying to get right to sleep because their bodies were exhausted or they felt the fatigue, and their bodies just had not gone through the proper preparatory stages in order to sleep. Their minds were still active. Their bodies hadn't decreased. One of the ways that we were able to tell that not only was the level of deep sleep architecture they were getting at the beginning of the night, as they were getting more light sleep, more awakenings after sleep onset, but the other thing we were noticing was, one of the things we measure is sleep index or recovery, sleep recovery, which is an indication of how long it takes your heart rate to decrease after you've gone to sleep. Normal architecture is it slowly starts to decrease through your midpoint of night, and then it slowly starts to come back up. And it's not a big difference in heart rate, but it is noticeable. It is measurable. And we were finding that on average, these individuals, their restorative time was very long. And it was lining up with their disrupted sleep and their change in deep sleep pattern. So we were able to come back to the company and make recommendations on, hey, let's not take our work home as much. Let's focus on work when we're at work and be productive. And then let's focus on your lifestyle and your balance of life after work. And the company took this to heart and started to make some, I think, heartfelt and company-focused strategic changes to help with this. The second one is with a sports team. People may have read in relation to Aura that there are a number of sports teams who have engaged recently, certainly during the COVID period, with Aura. And one of the things that we found was with Formula One racing. And what we were finding here was with heart rate and HRV patterns, and how a driver was responding and reacting to certain track environments, certain levels of stress during driving. And I think so many people don't realize how stressful it is to be going hundreds of miles an hour for hundreds of miles on courses with very tight, spaces between individuals. So what we were finding there was that their medical team was reviewing HRV and heart rate related to different stressful events or different stressful moments on the course during racing, and how could they help with things to relax the driver, not only in seat position, but in just general mindfulness that was helping them be more mindful when on the course and be more present in the moment. Okay, I'm focused on my driving, and how do I take all of that in and have that be effective? And of course, how was their sleep? Were they getting the good quality sleep, which relates direct to that? So those are two things that we've seen from an organizational perspective with our direct work.
Yeah, that's really fascinating. I never thought of the, looking at the decrease in the heart rate, the rate of reduction of heart rate, as an additional factor, in addition to the sleep latency that obviously we look at on the EEG. And I'm sure, Amir, with Vesper, you probably are going to be able to give us some physiologic data, that we probably haven't thought of in terms of sleep physiology before as well.
Yeah, definitely. And I think that, we are collecting data that clinicians already are able to use, which is a big advantage. I think one example regarding maybe companies and enterprises that would benefit from a solution like ours, and we're now implementing those solutions, is actually safety sensitive industries, safety sensitive companies like transportation, construction. So we were pretty surprised. I mean, some of them have already programs in place to diagnose and monitor employees with sleep apnea. So this is obviously like a challenge by itself, but actually most of the main challenge was actually they were losing employees because of the long process of diagnosing and putting people on treatment. So with a solution like ours, they can much more quickly get people diagnosed and get them, hire them if they want to. Because what happened that they just missed the opportunity. It took like 1 month to get them in a sleep lab, get the results, get the right treatment, make sure that they're compliant, and only then they could accept them to work. So that's kind of an interesting niche or example that we saw, and that actually surprised us for companies.
Yeah. I'll ask a question that I was actually going to ask a little later, but it seems like a good time to jump in with this. It strikes me that there's these consumer technologies, right, that are actively available to patients, and they give the patients all of these data. And then there are these diagnostic tests that actually you can base a diagnosis on and even prescribe therapy for. And Amir, your company has gone from being what sounds like a consumer device, right? And now you've just got FDA approved. So congratulations. That was incredible news. But you've now gone from a consumer company really towards the medical end. And what's your strategy? How do you marry both of those, those diametrically opposite seemingly aspects of your company?
Actually, it's a great question, Dr. Bajwaria, but I love the conversation, right? Because, being in the sleep industry for a long time, it's the idea that I think Ed said it, patient fix me, versus, I want to be responsible for my own health, or at least be a partner in this process.
So it's a great question. I think we put a lot of emphasis on the longitudinal nature of the data that we provide. And one thing that we did early on, and we prioritize actually, is to build an interface for the provider as well, and to give them the data that they need to work with. So actually, most of the early work that we've done was with providers, with sleep physicians, sleep technician, dentists, to get a very good understanding of what they need to monitor, and what type of data they are looking for. And we build the system in a way that allow them to really monitor effectively the data that they're interested in. So we are collecting relevant information like breathing disturbances, heart rate, sleeping position, things that really affect sleep, and allow those providers to evaluate their intervention. And I think that's one of the strengths that our platform provides.
I'll add to that and say that one of the things that we're doing from an Aura perspective is when we're working with partners, whether it's a sports team, an organization, a group that is interested in data evaluation and trending, Dr. Chase, is we have an API-driven system called Aura Teams. And this allows an individual on the side of the organization, whether it's a physician, individual, or an organization and medical team, to take a look at all of the contributors to all of the raw scores that an Aura metric app would capture for them. So they can look at 30 to 32 different metrics, and not only look at the individual metrics, but look at those metrics over time. Look for data trending, look for daily averages, look for outliers in data. And the range is significant. It's not just, did they have disrupted sleep? Is what was their HRV average, and what was their total sleep, and what was their disrupted time, and what was their deep and their REM sleep, and not just as percentage of total time, but actual time as well. So by having this viewable screen where not only you can look at the metrics, but create metric sets. Hey, I want to look at this population or this individual with these key metrics. You can create this. In addition, we have lifestyle contributors that go in that we call tags. Was an individual stressed? Was an individual just getting a COVID shot? Was an individual utilizing alcohol? Was an individual exercising late into the evening? And that individual can create a tag by going in and clicking on the actual tag. And it's now a time and date stamp that gets overlaid on top of the data trends. So it lets you know what they did, when they did it, along with the trends themselves. And then you can look at this window in as big a window as a 35-day window. So you can look literally across time, and you could scroll forward and back depending on, okay, we just made an adjustment in their oral appliance, or they just recently received the oral appliance. So now we want to follow them post or pre and post oral appliance, and then adjustment, and then see how they have adjusted with their metrics as well.
And what are the metrics that you're measuring that I'm looking at?
They're significant. They're heart rate related. There are sleep related, meaning contributors in the sleep architecture like deep sleep, REM sleep, recovery time, restorative time, heart rates, lowest heart rates, total sleep time, sleep latency, number of times they've woken up in the period of time in which they've woken during the night. We will be in the future adding more features such as SpO2 that will be captured and placed into that data trending as well. So these are some. There, as I said, there's a list of 32 that I can't always rattle off as quickly as I'd like, but those are the type good sampling of those that you might be interested in.
Yeah. Ed, you rattled off many of them, but one of the things that Aura, at least when I go to your website, they emphasize quite a bit is the heart rate variability, right? Yeah. And I think for many people, the term heart rate variability versus heart rate is not entirely clear what the two are. So could you tell us a little bit about, what is the difference between those two, and why is heart rate variability is something that you monitor so closely?
Okay. So as most of you know, heart rate is measured in beats over a period of time, 60 beats per minute. And it's an indication of your activity or your rest. So obviously when you are at rest, your heart rate tends to be lower as compared to when you're out for a run or, engaged in a more vigorous activity. Where heart rate variability is just that. It's measuring the microsecond variation between the R to R interval in the QRS EKG signal. So we know that heart rate is a good indication of your exertion. But we also are now becoming more and more well-versed, and when I say we mean science in general, more well-versed on how HRV is a good measure of general stress in a given period of time. Now, stressors are many. There's physical stress, there's psychological stress, there's being stuck in traffic, there's having an argument, there's working on a project, there's poor sleep and sleep deprivation, there's respiratory issues that are associated with this. And as you see the HRV trending, decreasing, you're seeing a representation of more stress at a given time. When you see it increasing, you're seeing less stress in a given time. So for instance, we measure HRV in the overnight sleep period. And what's happening during that time is, as if we are to see, and we should expect in good restorative sleep, the HRV trend going upward as your body is getting restorative sleep, you're recovering, the metabolic functions that take place during sleep are acting as they should. But when we see HRV that is flat or on a downward trend, we start to make some more inquiries. What happened in the evening before? What's happened in the 3 days prior? What has been the lifestyle things, their sleep hygiene that they've engaged in? Is their mind still active? Are they suffering from sleep deprivation, insomnia? Are they having sleep apnea that is causing this disruption, and therefore their metabolism is working extra? We think about, or I shouldn't say we, I as a physiologist think of HRV as RPMs in your car.
Yeah.
Okay. The higher the RPM, the more metabolic function the engine is utilizing, less the more rested you are. And that's what we're seeking, is restorative sleep should give you higher HRV and therefore more rested and recovered body. Does that help with your question?
So yeah, so to tag on to Barry's question, for somebody who's having a dental device treatment for their obstructive sleep apnea, would it be fair to say that you should generally expect the heart rate variability to improve or increase as the obstructive sleep apnea is improving? Would that be a good clinical signal?
That would be an excellent connection, that their HRV trending is starting to show upward. Now, HRV is very individual. It's not like heart rate, where a more well-conditioned athlete is going to have a lower resting heart rate and a less conditioned athlete a higher resting heart rate. HRV doesn't work that way. So you're not looking at the number, you're looking at the trends.
Yep.
And to your point, if you have an oral appliance in and you're looking to see if it's reducing the sleep apnea and person is getting more restorative sleep, absolutely. That trend would definitely demonstrate that.
And Amir, in your case, I would presume that, if somebody had a dental device treatment for their obstructive sleep apnea, you could, in a very traditional way, look at the AHI and look at other things with your device. Is that correct?
Exactly. And I think that's part of what we described before, that, we show the provider, the dentist, the number of inconsistent breathing events that we see along the night. So you can really see a very clear correlation, or clear indication that the device actually work. I will remind that we are measuring respiration directly, whereas in respiratory effort, we calculate breathing. So we can really see it one-to-one. We can see if you had more events per hour or more or lower breathing quality before the appliance was inserted, and after. As you titrate, you really want to see that it goes down alongside with the feedback from the patient that is comfortable and they can sleep well. So we're actually transitioning the dental appliance titration process from being very subjective, very episodic, to something that is almost real time, continuous, where immediately when you adjust, you can see the next few days, you can already see the improvement, or if something goes wrong. And I think that—
Do they just keep the same patch on for several days, or do they change the patch every night, or how does?
No, currently they are being used like per night. So we have like a clean adhesive that you can replace every night, and then you can just go sleep with it and really see the effect. And I think that it gives a lot of power for dentists to see the improvement of their devices.
Amir, I would think also that the transition with people who are, so often someone comes into a sleep physician's office, Dr. Bijwani and I have spoken about this, and the trend is, okay, we're going to give you a CPAP, and not thinking to oral appliance. And so here you have individuals who are prescribed a CPAP. They're not compliant with it. They don't like it. There's many psychological and physiological factors, fit and seal and variety. I mean, I would think it would also be beneficial from a dental sleep perspective to help demonstrate the value of the oral appliance in comparison to something like a CPAP device. Would your technology certainly would allow for that, would it not?
Exactly. You really, make oral appliance therapy more quantitative right now. With this objective measurement, you can see that the effectiveness of the device over a long period of time can actually improve. And as I heard from Dr. Chase, the effectiveness is the amount of time that you're using the device, multiple the efficacy during every night. Many times, CPAP is very effective for one night, but if you are not compliant with the device, it's not really helping the patient. So now we can actually prove that oral appliances can be as effective or as efficient as CPAP in many cases.
Yeah, we had actually the conversation, Dr. Van de Veken's idea about mean disease alleviation, the difference between an AHI of efficacy, right? While they're wearing a CPAP machine, it's efficacious, but overall efficiency, including the amount of time that they're sleeping, that AHI doesn't throughout the night give the patient the ideal benefit, versus if they're wearing an oral appliance, they may have less of a degree of resolution of an AHI, but because they're wearing it for a longer time, the efficiency versus efficacy is improved. And I'm very partial to Dr. Van de Veken's research and idea about the idea of mean disease alleviation. The other thing that I was thinking about, in this conversation is, I had a patient today that called. They were out of state and they had gotten a number of dental consultations, and in the conversation that I was having to them over the phone, they would decided to make an appointment with me, to come to the office. And I said, oh, by the way, we can monitor how the appliance is doing, because patients sometimes prefer the CPAP machine because they're going to get a nightly reading of AHI and oxygen desaturations, and that doesn't exist until now, I'm going to say, with these monitoring devices. So it was a big win for the patient to hear that, oh, by the way, I can monitor your sleep with the oral appliance using one of these monitoring devices. And that was a big hurdle for them to get through and say, okay, Dr. Chase, I'm going to come in and, because you can monitor my device, I can, I can be confident that the oral appliance is working. And if it's not, of course, you can adjust it. But one of the parameters, of course, that's on everybody's mind is oxygen desaturations. So my question to both of you is, how do you plan? How is that? How do you plan to incorporate that in your monitoring?
I'll start with this one. I mentioned measuring of SpO2 earlier, and it is a feature that the Oura Ring has the capability of capturing. One of the things that's being done now with the science and data teams is not only the capture, but the validity and reliability, consistency of the capture. So that's something that is in the works, something that hopefully in the near future will be something available to consumers utilizing the ring. But one of the things that we certainly would do with this is not being a diagnostic tool and being more of an awareness tool, consumer awareness tool, is if we were to see an individual who was showing decreases in SpO2 during the overnight, we could engage that person in, since we cannot diagnose, we cannot prescribe, not being medical practitioners, licensed practitioners, we could have the conversation. Have you spoken with a sleep physician? Have you been having trouble with your sleep? Give them things, stop bang, or something that they could use very consumer oriented to say, boy, you know what, maybe there is a connection between my poor sleep and my breathing, and we could get them, help make consultation or get them at least comfortable with the conversation with a sleep physician or sleep dentist. So this is certainly something that we hope to do going forward, but at the moment we're still refining before. We don't want to put it out until it's really, we feel comfortable with the values.
In our case, we, once we launch the diagnostic device, we're going to have an SpO2 measure as well. So this will basically provide a complete picture for the diagnostic test. So that's one thing. I would also add that, pulse oximeter we mainly use so far because they were available for dentists and for consumers, but in many cases you don't capture respiratory disturbances just by using SpO2 measure, and I think the ability to measure directly respiration actually can help detect even milder phenomena and even progression, like small progression of the disease over time. So that's another piece that I think now become available to dentists and clinicians to see those changes in respiration event even before they create desaturation events.
Yeah. I think my comment on both of those things would be, I think there's this tremendous, I'll say, opportunity and maybe even responsibility for companies that are monitoring patients proactively and identifying things that are potentially dangerous, right? To partner with clinicians like dentists and physicians so that there are seamless pathways, because patients, often will get information, but they don't know what to do with it. And it's really difficult for those patients to navigate the medical system sometimes. So I really would look forward to the future where consumer devices and diagnostic devices really are trying to engage with the physician and the dental community actively to find pathways for those patients once they've been identified with significant issues. So, that's just a quick comment on my end. I think,
Dr. Bijwani, if I may, you and I have had this conversation directly and have worked on this directly. And I think that there's so many opportunities out there with data, medical, wearables, assessment, where you have the individual who is much more well educated, much more knowledgeable, who is just looking for confirmation from a device. And then they can have a deeper conversation with their dentist or physician. There's the individuals who aren't sure and are looking for some more data and then perhaps some guidance. But then there's the individuals, as I've said, in the solution pathways that you and I have talked about, who there's the identification of a potential diagnostic. And by having that connection, that partnership with the clinical physician, dentist, you now have that opportunity to better serve the pathways of solutions to the individuals that you're engaging with, or the populations that are utilizing your devices. So I 100% agree with you that this is an opportunity that is not yet fully baked itself, and I'm waiting to pull it out of the oven and slice it and utilize it amongst our consumers.
Although it seems both of your companies, of course, Ed, you're the sleep coach, and obviously you're advising patients, for Aura. And Amir, you have a pathway for patients already where they can talk to somebody and sort of understand some of that data. So I think both of you are, getting towards that point where you may not get straight to a doctor, but at least you're trying to help patients understand that data, which is, I commend both of you for that, because it can be very confusing for patients, especially with the 35 or 36 data points that Ed talked about. Which, leads me to another question. When patients come into the office with a multitude of variables, some Fitbit, Jawbone and Aura, and all of them, have different metrics, right? Some light and deep sleep, some, sleep fragmentation, some sleep quality. And as a physician, and I'm sure the dentists who are listening in have the same issue, it's very difficult for us to advise patients not knowing what that data actually means in terms of the physiology that we're looking at. And do you think that in the future there might be some standardization or some guidance from industry so that we can all be looking at the same variables and understanding the same, sort of singing from the same page?
Amir?
Part of it is all of these companies are trying to, obviously create a niche for themselves, right? And differentiate themselves from the others. But the price you pay is that there's all this data that it's often becomes more like noise for a physician coming into these conversations with their patients. Just interested in your perspective.
And Doctor, I just want to add one other thought around that is, so patients have a logical mind, and just what you're saying, they're taking this data, and in their logical mind, they think in the syllogism of, all right, if this is what the number is, then I should get that. Right. And we know that's not how the human body works, right? Or they're thinking in much more black and white terms. But we understand, the pebble in the pond and all the ripple effect, right? And consequences with other, physiologic systems that it affects. So on the one hand, we certainly congratulate all the monitoring, but we almost need a warning for the consumer that, and what I like about the Wesper is, for an undiagnosed patient, please call our physician and have the conversation, because then they go on Google and they go, okay, my numbers say this, and therefore I should get that. And I go, oh my goodness, that's not how this works.
Right. No, that's very true. And, many physicians, sleep physicians actually as well, come to us and say, many patients come with their wearables and say, okay, this is my score. How can I get more RAM, less RAM? And they really can't help them. And that's actually frustrating from the physician side because they can't give the right answer for the patient unless they see the data themselves in ways that they are used to see them. So I think there are a few ways to think about it. One is provide the physicians and clinicians with the tools and the data they are used to in order to develop together with them the metrics that actually matters. That matter to sleep quality and sleep health in general. So that's one piece. How we can show present clinicians with the data that they care and they know how to interpret, which is key, because if you just tell them a number, if you just tell them, these are my sleep states, it's very difficult for them to work with. And the other side is really the awareness that I think companies like Aura and Whoop and other wearables really doing an excellent job in raising awareness and making people care actually about their sleep, about their wellness, much more than before. And I think that's really will help complement the picture.
Yep. I have to say, just to piggyback onto Barry's comment, when we see patients who have severe insomnia and difficulty staying asleep, sometimes it's actually helpful for them to not look at their data, because the anxiety of seeing night after night that, I'm not getting REM sleep or I'm not going into deep sleep can actually worsen their sleep. So I think, part of it is the thoughtful use of these consumer devices, right? I mean, and I think, it just goes to more patient education and all of us working together. So, so both of you obviously are, we're super lucky to have you because you're on the cutting edge of sleep technology. And I'm curious, as you look out in the horizon, right? What are the technologies in the sleep field that excite you? And either one of you can start. What should we be looking for in the future? Artificial intelligence, where are we going with sleep, do you think?
I'll start with this one, Dr. Bishwadia, because this to me is the uniqueness that I have from a personal philosophy, and that is device to your point that you were speaking to before about the anxiety that can be generated from data. We see this. We've experienced this, where an individual gets so wound up about what their score or their metrics are that it actually leads to more disrupted sleep or more insomnia or poor latency or whatever it might be. So one of the things that I have always focused on is when you're utilizing a wearable that's an awareness tool, not a diagnostic tool, remember that it should be a way for you to better learn how to understand the signals that your body, the world's best wearable, is your own body.
Mhm.
And how you can use the wearable to help refine your sense of self. So when someone gets a wearable, they're going to be so engaged that they're probably going to wear it often. They're going to look at the data every day, and they're going to get, but I always counsel them by saying, it's not just about that. It's about, are you empowering yourself to use when you're tired, do you sleep, or do you stay up and watch an extra show? Do you get back on the computer? Do you browse your email? Or, if you know certain things are happening in relation to that, use that. Be smart about listening to your own body, and then use the wearable to reinforce those signals or modify those signals that you're using. When it comes, so from that point to your question, for me, yeah, there's a lot of great technology out there. There's light bulbs now that supposedly track your motion at sleep. There's the connection between what's happening in wearables and what your Alexa will tell you to do. So there's all of these things going on out there. But if it doesn't allow the individual to enhance their awareness and then utilize that awareness, then to me, it's not exciting technology. It's just another device that someone can buy. Oh, let's buy the next pillow. Let's buy the next wearable. Let's buy the next monitoring device. So for me, I see technology that's more consumer health oriented out there that's very interesting, like the Actia wrist-worn continuous blood pressure monitor. I look at things of that nature because that's well-being oriented, and we know your well-being has an effect on your sleep. There's the interesting things with the electric toothbrush company that now has it was at CES, I forget the actual which Philips, I guess, who had a toothbrush that not only helps you with coaching by having lights and timing, but also has certain other things that it provides you data-wise as to how you should brush and when you should brush. That's very interesting to me as a consumer and someone in the health and wellness field, because it's directly actionable to their betterment. In this case, with the electronic toothbrush, better oral hygiene.
Great. Amir, any thoughts?
For my part, I think if you look in the future of sleep devices and generally technology, I think two main factors come to mind. One is form factor, and I think that devices become more integrated, more kind of imperceptible, if you wish, in our daily life, smaller, or is a great example for that, more flexible, maybe more like adaptive to your body, so you actually don't feel them. So that's one trend that I see that coming in the next few years. It will become much more seamless in our life, even wearables. The next thing is obviously, we touched a lot on this, but data and algorithm, like prediction, the ability to predict, become more personalized. I think this is going to grow more and more. Also understanding specifically on sleep that it's multifactorial. It's really related to other elements of your health and wellness, other elements of your lifestyle, and we will learn much more about this. If you think about it, until now, most of the knowledge about sleep was collected in sleep labs, which is not the natural environment. It's not really, again, it's one or two data points per person. Now we start gathering lots of information, multiple nights, the same person, different type of demographics, and this will allow us to push sleep medicine forward much quicker than before.
Yeah, that's great. I think, my own perspective is that the emphasis on the diagnosis of obstructive sleep apnea is just going to disappear, because obstructive sleep apnea will be something that a patient can diagnose themselves with the help of consumer or technology. And I think sleep physicians and dentists, and we'll be concentrating more on the therapeutics and the chronic management of the effects of sleep. And that's where I think where I see the future going, at least in the next few years, for our for our profession.
Yeah, I have a question for Dr. Bijwaria and Amir and Ed. And as we're talking, as the Aura Ring was a concept, however many years ago, and as Wesper was a concept, however many years ago, and whatever the foundation of the idea was, generated to, like, I'm going to serve this community. And as you, Dr. Bijwaria, as you navigated through patient care over the years, how has your perception of the demographic or the profile of the patient that is using wearables, that is using technology, changed from the original concept of what the Aura Ring or Wesper to now a few years later to the actual demographic or profile of the patient that's using it? In other words, I've presented some technology, whether it's even a SnoreLab app or one of the wearables, and I'm sometimes surprised as to the profile of the patient that wants to do it or doesn't want to do it. And we're talking about changing the face of, like you just said, maybe patients diagnosing themselves, but there are certain patients that are very resistant, some patients that are, I want nothing to do with technology, and other patients that really want to take, a firm grip on their health and well-being. And, I'm just curious as to, when we have an idea of, we're projecting, this is the profile of the patients that I think that's going to purchase and use a monitoring device versus the reality of the profile of the patients that actually does it. How has that changed? And to you, Dr. Bijwaria, how has that changed in your practice as well?
Well, I'll let Ed go first, because obviously Aura has many thousands, maybe hundreds of thousands of users. And what kind of user profile are you seeing, Ed? I'd be curious on that too.
Well, we're definitely seeing a wide range. We're not just seeing the individuals who begin physiologically age to start to have sleep-related issues. We are seeing people from 18 up into their 80s who are utilizing, male, female. We're seeing athletes who are looking at it to improve their sleep, their physical performance. We're seeing individuals with known sleep issues looking to it to understand better about what's happening to themselves. But I think the most interesting thing in the profile of the individual is that the opportunity for the types of data that can be collected can help in other areas. Certainly during COVID, there was a large jump in user population because of the ability of temperature capture and the quality of that. And therefore, there was some research done by the data science team, and it was found that there was, through evidence-based research, a 2.1 day precursor to positive COVID test just by the data captured. So what we are finding is we're getting a lot of feedback from users. Hey, I woke up this morning, or I noticed that my temperature was starting to elevate, and something said to me, go and get a COVID test. And sure enough, I had COVID. And so that's one interesting area. And then the third is reproductive health. Again, utilizing temperature sensors and the opportunity for individuals, females, obviously, to have prediction of early pregnancy before even a pregnancy test. And that was something very interesting as well. So I think what's interesting, and Amir may also agree with this, that wearable technology in general, it's the data opportunities that drive your consumer, or the opportunity for consumer engagement. More and more data opportunity with a device that you may have not thought about in the very beginning may now become more apparent, and you have another consumer group in which to engage in. So I'll pause there.
Yeah. Go ahead, Amir.
I'll maybe speak from another angle. I mean, when we started working on the device, we definitely saw diagnostic capabilities and the ability to really detect sleep apnea. What we found interesting, with user recently, that actually people that were already diagnosed with sleep apnea were more engaged than others. And this actually strikes when you look at the data, say how, I mean, they already diagnosed, why do they need even the platform, why do they need to monitor? But it actually shows how complicated the sleep improvement journey is, and how, you know, how much guidance they need. So they use the device in order to track different experimentation, different lifestyle factors that they do on themselves, because they are not happy with the current situation. They are not happy with the current treatment. Maybe they left their treatment and they want to try new things. And this really, I think, pinpoint the issues in the current paradigm of sleep medicine. So I think that was one interesting point. Another angle maybe on the operational aspect of the device, we always thought about it as a kind of a one-time diagnostic test, because this is how sleep medicine works today. But soon enough, we realized that actually the ongoing monitoring of the condition is of most important, because it really shows how the disease is progressing and what type of intervention actually help. So that's another shift that we also did with the device. So I think two interesting points.
Great. I'll just end by a quick thing. For me, technology, I love being at the cutting edge of technology, because all of us, patients who come in who have experienced going into a sleep center and having polysomnography and everything, all of a sudden you show them like a little, button like Night Owl that sits on your finger, or a sleep imaging, and their eyes just light up, and they're like, "Oh my God, that's the test!" So it's just a fun, it's a fun space to be when you're having that conversation with patients.
From my perspective, I'll if I may, Jagdeep, the opportunity that I mentioned earlier about the engagement with physicians or medical teams and the Aura Teams platform is something that is allowing data to be distributed and engaged from the medical field. And the team that focuses on that in creating those relationships or taking on those relationships with interest is always working. Amir, you said it, I think, so well before. And Dr. Berry, you said this as well. How is the information being disseminated, and in what format, and in what types? What are you looking to see? And so as these conversations continue to take place with the clinical world, we are able to adjust how and what they're seeing, what sets, what information, what data time. And this is something that we have been working on and continue to progress. So that's from our perspective, one of the things we're working on.
From our angle, it's again, we're working with metrics and signals, data that clinicians already working with, and we have both a web application, provider portal that that provider can actually work with, and API that can connect to their own system. This will be in the near future. So that's I think maybe the most seamless way for providers to get the data that they need without having the patient deal with very complicated procedures. So that's our approach in that case.
Yeah, so I use monitoring devices, and they're very cost effective. It's a one-time purchase by the patient, which is very minimal, and they're certainly more accurate than some of the download apps. And it's a very cost effective to titrate the appliances relative to the data that's given back by these monitoring devices. I think it's more accurate. Cost effectiveness is always relative to outcome. If we're comparing it to a post-insertion sleep study, which of course is triggers an insurance event. But I would say it's using the monitoring devices that we're talking about are the most cost-effective ways of creating the outcome. And if we're creating an outcome, it's cost-effective. That patient's getting better, and if they're getting better, the cost-effectiveness is huge.
you can distribute the kit to the patient, and then they can reuse it for a period of 2 months with the initial price. In this period, they get all the adhesive that they need, messaging with specialists, and really can monitor their progress and adjustment with the device. And yeah, feel free to contact me afterward. I can provide much more details.